Hi everybody, thank you for joining us. I'm Larry Little. We begin this program this morning with a special focus on mental health. I'm joined this morning by David Mineta, CEO and President of Momentum for Health. And in just a few moments, we will discuss how this pandemic is affecting Santa Clara County. But first, I want to let you know that we have removed our facial coverings for this segment so that everyone, including our ASL, American Sign Language interpreters, can properly communicate and understand the information that we will be sharing this morning. Thank you for being here, David. I know you have been busy since this pandemic started, and it looks like there is no end in sight. I was reading an article in the Mercury News, a great article by Martha Ross, and it said that we have lost access to the things that normally keep us well, and people may have resorted to less healthy coping mechanisms to survive. You know, people have lost loved ones, jobs, some have had to close their businesses. We don't know if or when school will start back. People are facing food insecurity. Some people are unemployed. Some people may face unemployment in the future. And the list just goes on and on. What are you experiencing at your agency right now? What's happening in the community?
Well, thank you, Larry, for this opportunity to be here with you today to discuss both mental health, and I also want to include the substance abuse disorder side of the house as well. We call both of those, mental health and the addiction side, behavioral health. So in Santa Clara, on the behavioral health sort of climate environment, I'm not sure if we've ever seen anything quite like this. And meaning both the depth and the breadth of the behavioral health issues, not just here in Santa Clara County, regionally, across the state, across the country. And the stresses that we're all under are enormous. So folks, what we're seeing is that folks who didn't have a behavioral health disorder or condition, many of us are starting to feel like we're experiencing that now. Mm-hmm. You could be tired, you're irritable, you're more shorter attention span. So, you know, it feels like that's just normal life now. Mm-hmm. When you add in all those other litany of issues you just talked about, people's stress, anxiety levels, depression levels absolutely are increasing. So folks who had pre-existing behavioral health conditions, it's even harder for them now. Mm-hmm. And then for those of us who were without, we are now experiencing those some of those conditions. So all told, again, breadth and depth, right? Just so much wider, so much deeper.
You know, there is a misconception about mental health, and you know, I go back to my childhood and growing up with my family and the culture, and they always associated mental health with the person that is on the street corner talking to themselves, but that's not the case. Right. All of us deal with some level of mental challenges.
Yes.
And so are you seeing more people seeking help now?
So it's interesting. It's a great question. Our agency, Momentum for Health, works in the county system. So that's the public system, public sector system. And for many months, there was a reduction actually in referrals as people sheltered in place. They stayed home, they followed the guidance, they followed the orders. What we're seeing now is an increase, right, in people accessing call centers, as well as on the commercial insurance side, people who have health insurance who are now calling for behavioral health services. So all of that is actually going up now. And we fully expect, as I think, you and others, in the community can imagine, that there's a lot of pent-up demand right now. Mm-hmm. and issues. So we believe in the field that there is a tidal wave, sort of a tsunami on the way. And we're beginning to see the leading indicators, I think, data-wise, of that tsunami.
You know, going back to my childhood, there was such a stigma with mental illness. And so some people feel like they don't want to seek professional help. And some people are even ashamed to seek professional help. What's your message to them?
Yeah, and I think, thank you. That's why this Facebook Live session is so important, and getting information out to the community is so important. Number one is we hope that folks see their behavioral health conditions, or any behavioral health condition, just like any other health condition. So if people have a heart condition, if they have cancer, they have asthma, they have diabetes, people seek help and treatment for those health conditions. And generally, there are not stigmas, and as strong a stigma as attached to behavioral health. And I think that's a perfect example that you gave, Larry, about if you have a mental health condition, then it's like maybe less than you. I mean, pejorative terms, crazy. If you have a substance use disorder, then they're worried about the sort of criminality to it. Those are health conditions, and we need to treat them as health conditions. So again, treatment exists. There are 30+ agencies across Santa Clara County that are right now open providing behavioral health services to income qualified and medically, and people who reach medical necessity, but 30+ agencies for kids who work with addictions, mental health, older adults. And many have been here in the county for years and years and years. Some of the best in the state are here in the county, and they're open. So again, you can go to the county website for the provider list. You can go to our website, Momentum for Health. We have a resource list. It's listed. Please seek help.
I want to touch on seeking professional help because there have been times in the past when people have someone in their families and they have a mental challenges, and family members feel like they can handle it, or they send it to the pastor at the church. Talk about the need to seek an actual credentialed professional to treat mental health challenges.
But I think I want to underscore, though, something you just said, right? In different communities and in different faiths, there are people that we can talk to, that we can go to and seek advice under difficult circumstances. These for sure are difficult circumstances. Please seek out folks that you trust, that you can confide in, and include in that group also professional behavioral health experts. So again, clergy, for sure, close friends and relatives. The key is to talk. Don't bottle it up. Is to seek assistance where you feel like you can, you can get healthy and good advice. But also think about the mental health and addiction professionals, particularly who can help in these areas. That's really critical. In language, from your cultural background or your faith background, there are those professionals out there able to help right now.
Yeah, and this virus and the impact to the community is affecting all of us in different ways. A lot of people have that only me feeling. I want you to talk about that a little bit, because a lot of people, maybe they had to close their salon and they feel like I'm the only one being affected, and they probably watch me and they say, oh, he's not being affected at all, when one of my closest relatives is recovering from COVID. So talk about that only me feeling.
Yeah, and this is I think part of the condition that exacerbates our the stress and sort of depression and all those sort of key indicators of emotional distress is feeling alone. And when we're sheltered in place, it's so much easier to feel alone and feel isolated. So it is more important to to reach out to other folks, your own connections, check in on people, ask how they're doing. And again, the behavioral health professionals in the community are under similar stresses, our own family members. And so in many ways, we're all trying to practice these same best wellness practices as possible. Again, I would underscore, just as in addition to seeking professional help, be mindful of your sleep, your sleeping patterns, how you eat good healthy foods, get exercise, get outdoors. And we find that those three things, in whatever pandemic or natural crisis or there's extra stress levels, we really have to be mindful of those three things. And sort of basic building blocks of our own mental wellness and resiliency.
Let's talk about your agency, because in previous years, mental health assistance was only available to those with the financial means. So your agency actually works with people from lower incomes and the homeless as well. So talk about that a little bit.
So when the pandemic, when the shelter-in-place order came out from the health department back in March, so overnight our agency went from mostly face-to-face to having to turn to doing remote services by phone and virtually. So we now provide about 80% of our services, and not just us, but other behavioral health agencies in the county. About 80% of our services are now over the phone or virtual. And it used to be 1% before COVID, less than 1. So, a lot of agencies have had to adapt. We see about 20% of our clients are also not housed, and then even more who have insecure housing. That's a lot of folks who are also dealing with a mental health condition or a substance use disorder, and doing the best they can to maintain their recovery. I'm proud that our staff we operate 24/7 programs, 24/7 round-the-clock programs, residential programs. Those have been up and servicing folks the entire time during the pandemic. Our outpatient programs had a slight dip, but actually still seeing people, servicing folks over the phone or virtually. So again, I just want people to know that those services are open. And again, not just us, but there are 30 plus behavioral health agencies open in Santa Clara County right now.
Mm-hmm. And some people are dealing with grief right now, which may have pushed them into a space where mental health issues have manifested. What's your advice there?
Yeah. Again, sadly, so many of our neighbors and are dealing with losses and grief. One is, again, I think is we want to underscore, keep talking to folks. Try not to isolate. Many of the families, I think, our family included, are dealing with a lot of different losses. Again, seek help, talk to folks that you feel comfortable confiding in, probably don't try to manage this on your own. That's probably one of the key parts of messages during the pandemic.
Closing message. What's your advice to the community in seeking help for mental health issues, as well as people who work in the profession, because they're seeing different stress levels as well?
Yes. Well, first thing is, if I could, I'd like to actually provide a couple of numbers for folks. These are call numbers that they're run by the county, And again, I just want to underscore, I think, how fortunate I feel to be living in Santa Clara County. And so thanks, Larry, for this opportunity. But also to say that our county has been very much on the forefront of trying to prevent infection, trying to provide the services, including behavioral health, right, along with the health services alongside. So I want to give two numbers. The first is the mental health call center number. This is operated 24 hours a day, 7 days a week. It is 1-800-704-0900. Again, this is the mental health call center. 1-800-704-0900. It's in different languages, again, 24 hours, 7 days a week. I also like to give the substance use disorder hotline number, gateway number. That is 1-800-488-9919. That's the substance disorder gateway number, 1-800-488-9919. Again, I would encourage folks to reach out, call that number if you have concerns for yourself or family members who may be experiencing mental health issues or addiction issues. Finally, for those with health insurance, call your health insurance. If you have a behavioral health concern, again, for you or one of the covered members in your family, call your carrier. Tell them that you have these, just again, treat it like any other health condition that you have. Reach out for help. And if you don't get the answer you need, call again. We need folks to keep advocating for treating behavioral health just like any other health condition. It's as important, and it needs that much attention at this point. So, again, thank you. Please check our website, Momentum for Health. We have a resource list there and of other community resources. Again, there are 30-plus agencies in this county, and the Behavioral Health Contractors Association, BHCA, is a representative association of all of those providers. There's help for you in this community.
All right, David, thank you so much for being here. We'll have to have you back because we could go on all day about this
Thanks,
topic.
Larry. Let's do this, man. We can do this again.
So we'll have you back. I just want to say Dr. Cody will be speaking live here on Facebook coming up at 11 o'clock. And in dealing with mental health issues, those who are not dealing with mental health issues, love and compassion goes a long way. And, one thing I would say is be mindful and be careful what you say to people, even when you're saying it online. You don't know because what you say can push people to the next step. So just be very careful about that and use compassion. Dr. Cody coming up at 11 o'clock. We will see you back here for Facebook Live with the County of Santa Clara on Friday at 10 a.m. Thanks for joining us, everybody. Have a good day and be safe.